An optometrist asked a question to a community of eye care professionals, centered around whether it is safe to instill flourescein into the eyes of a pregnant woman during a contact lens check, and if not, what the potential reasons for this are. The response that got the most agreements was from one Optom, who replied by pointing to the College of Optometrists formulary, which highlights the lack of adequate, well-controlled studies on the use of flourescein in pregnant women. Animal studies have shown that flourescein can cross the placental barrier, so it should be used with caution during pregnancy. The formulary advises that flourescein may be used during pregnancy only when the expected benefit outweighs any potential risk to the fetus. The participant also mentions that while flourescein is excreted in breast milk, it is generally considered safe to use while breastfeeding. Another Optom suggested that the decision to use flourescein should weigh the benefits and risks. They propose that in cases like a contact lens aftercare check where there are no symptoms, flourescein might not be indicated. However, in situations where it's necessary to assess whether an infiltrate is staining, flourescein may be required. They also offer a potential solution to reduce systemic absorption by occluding the puncta, which can minimize the chances of the flourescein being absorbed into the system. A third Optom shared their personal experience, stating that they have instilled flourescein in pregnant patients in the past. They argue that flourescein is unlikely to be absorbed systemically when placed in the tear film. However, they emphasize the importance of obtaining informed consent from the patient after explaining that there is no definitive evidence confirming the safety of flourescein during pregnancy. They reassure that, although there is no concrete evidence, the risk of harm is extremely low. They also point to a relevant case scenario on the College of Optometrists website, which further discusses this issue. The conversation offers various viewpoints, all underlining the importance of caution and patient communication when considering the use of flourescein in pregnant patients. The general consensus is that the decision should be made carefully, balancing the benefits and risks and ensuring that the patient is fully informed.